This is the courtroom audio feed from the Conrad Murray trial in Los Angeles, California.
And Mr. Pena, the people are represented by their counsel, Mr. Walgren and Ms. Brazil. Dr. Richelle Cooper once again is on the witness stand, and all 12 jurors and the 5 alternates are present as well. Good morning, everyone. To the jurors, good morning. Hopefully you had a good weekend, ladies and gentlemen, and you followed my orders, all of them. Dr. Cooper, good morning.
Morning.
Do you acknowledge you are still under oath and that you are still sworn to tell the truth?
Yes.
Thank you. This will be a resumption of direct examination by Mr. Walgren. Good morning.
Good morning. Thank you, Your Honor.
You're welcome.
Good morning, Dr. Cooper.
Good morning.
Dr. Cooper, on Friday, you described your activities on June 25th, 2009, from the time of approximately 1:13 thereafter in your attempts to revive Michael Jackson, the decedent in this case. Do you recall your testimony?
Yes.
Okay. And I believe where we left off, we had gone through some of the photographs of the trauma bay, and you had also indicated that you had had conversations with Dr. Murray upon Mr. Jackson's initial arrival, as well as throughout your attempts to revive Mr. Jackson. Is that accurate?
That would be accurate.
Okay. And throughout those conversations, what he indicated to you is that he had given Michael Jackson a total of 4 milligrams of lorazepam. Is that accurate?
That's what I was told, yes.
Okay. And no mention of propofol?
No.
That's correct?
That is correct.
Okay. I wanted to follow up just very briefly. What was marked People's 48 for identification. Maybe dim the lights just for a moment. Please. Benson, thank you. Good point. Dr. Cooper, what is this item here to the right of the equipment cabinet that has the pole and then a rectangular device on top of it?
That is a small ventilator.
Okay. And I don't believe I'd asked you on Friday. What is this stand? This stand here to the left of the photograph has a pole and then 2 separate poles coming up from that stand.
Those are 2 IV poles, and on them, these are sort of like small computers. They're pumps to control the rate of infusion if you had an IV bag attached to the pole.
Okay, those are computerized infusion pumps?
Yes.
If you have an infusion line, they can be programmed to control the rate of infusion into the patient?
Correct.
Okay. The lights can be on. Thank you, Your Honor.
Thank you.
Now, in regard to your efforts to revive Mr. Jackson, you've described some of the team members that were present. I believe it was 14 people and additional individuals coming in and out. Is that accurate?
That would be accurate.
Okay. As far as resuscitative drugs, was there a process of different drugs that were given to Mr. Jackson during these procedures?
There were. As I was managing the code, so our nurses, the residents, pharmacies, and cardiology are all used to running a code, so many drugs were sort of considered, for which I then would give the final order to pharmacy.
Okay. What does that mean to run a code? What do you mean by that?
I was the final sort of say. It was sort of because there are a lot of people asking, can we do this, should we do this, there needs to be a final say to, yes, execute this order for the nurse, for pharmacy to prepare the drug and prepare the dose of the drug, but then also to tell the nurse to, yes, administer the drug.
Okay, so when you say you were running the code, you were in charge of these efforts
Yes.
and in charge of the team of medical personnel?
Yes.
Okay. And you were aware that the paramedics had given a series of starter drugs to Mr. Jackson, both in the field and also during transport, correct?
Correct.
Okay. And while at UCLA, were additional dosages of epinephrine given to Mr. Jackson?
Yes.
Okay. Was sodium bicarbonate given to Mr. Jackson?
Yes.
Was vasopressin given to Mr. Jackson?
Yes, it was.
And what is that?
It is another type of vasoconstrictive medicine, a different class of drug than epinephrine that is given at times during a cardiac arrest.
And the purpose is what?
Our goal is to try and attempt to have the heart pump better, to constrict the blood vessels and achieve a better blood pressure to the brain, and to actually restart someone's heart.
Okay. And was dopamine given to Mr. Jackson?
Yes, dopamine was given as an infusion, as a drip.
And for what purpose?
Again, it's a drug that can increase the sort of the strength of the way the heart muscle contracts, as well as can increase blood pressure and increase heart rate.
Okay. And again, during these efforts then, was a technician on site doing physical chest compressions?
Yes.
Okay. And did that continue throughout this, or throughout these efforts to revive Mr. Jackson?
From the time of arrival, no, I can't remember if it was actually when we do the, later on there's an aortic balloon pump, cardiology, I don't remember if we actually stopped compressions. In general, compressions are continuous and only stop briefly to check to see if there's a pulse or a response to therapy.
Okay.
So there are brief interruptions.
Okay, and there's a technician actually assigned that responsibility to do two-handed chest compressions on the patient?
There is. There's more than one. People get tired, so we rotate to make sure that compressions quality is adequate and maintained.
Okay. And the care for Mr. Jackson, you indicated he arrived at about 1:13 and in fact was pronounced dead at 2:26 p.m. Is that accurate?
That's accurate.
Okay. So during that hour and 13 minutes, the care you've described was pretty much continuous?
Yes.
Okay. And then these chest compressions from the various technicians at UCLA was basically continuous more or less through this hour and 13-minute
Yes, it
effort?
was.
Yes?
That would be correct.
Okay. And was there also a process by which Mr. Jackson was being, or bagging was taking place?
The respiratory therapist bagged Mr. Jackson throughout the resuscitation.
Okay, and what do you mean by bagging?
Mr. Jackson had an endotracheal tube, so it was a tube from his mouth through basically the windpipe into the sort of what we call the trachea, just above the lungs. That tip of that tube is then connected, there's a little connector, and there is what's called an ambu bag. And you physically squeeze that bag to deliver air, and in this case, oxygen, because the bag is then connected to an oxygen source.
Okay. And that process, again, was continuous for this hour and 13 minutes?
Throughout, yes.
Okay. And there was a technician specifically assigned to that task?
A respiratory therapist.
Okay. And you've described in the various photographs the monitoring equipment. Was there cardiac monitoring taking place throughout?
Continuously, yes.
Okay. Measuring, well, what was being measured?
Sort of an EKG rhythm strip, a heart rate, attempting to measure blood pressure if there was a palpable blood pressure. Respiratory rate is monitored, so it would actually record how many breaths we were delivering. If there was enough perfusion that you could actually measure oxygen saturation, which is measured peripherally, that shows up on the monitor.
That would be part of pulse oximetry?
That's a pulse oximeter, yes.
Okay. And all of this monitoring was continuous?
Throughout, yes.
Okay. Now, during this approximately hour and 13 minutes, did you ever feel or note a spontaneous pulse on Mr. Jackson?
I did not personally ever feel the pulse or confirm any pulse.
Okay. At some point, did you try to, was there someone in the room indicate that they thought they felt a
I think it was at 1:21, so approximately 8 minutes into the resuscitation, there was a report that someone, when we did a pulse check, reported that they felt a pulse.
Okay, and did you then stop compressions and see if you could confirm that?
When compressions are going, we could feel a pulse, but a spontaneous pulse without compressions, I did not appreciate. Around 13:21, I said, hold compressions, do we have a pulse? Someone reported feeling a pulse, at which point I attempted to confirm that. And the monitor still showed a slow agonal rhythm, which would not really be consistent with a regaining pulse. I then also confirmed the ultrasound, look at the heart to see if it was actually pumping in a manner that I thought was improved, and did not. And I could not palpate a pulse to confirm. And so chest compressions were resumed, and no other pulse was ever appreciated without compressions.
Okay. So through your own observations and the equipment you've referenced, you were not able to ascertain a pulse at that time?
At any time.
At any time, correct?
Correct.
Is it common in these situations for people to feel for a pulse and actually feel their own pulse and mistake it for the patient's?
During a code, it would not be uncommon for someone to think they felt a pulse, and that is why we always confirm.
And that is why, with all the equipment available, you can confirm through multiple means?
Yes.
Now, then at 2:26, did you make the determination to again pronounce Mr. Jackson dead?
Yes.
Okay. And that was actually the second time that you had made that determination, the first one being at 12:57 p.m. when the paramedics were out in the field with Mr. Jackson?
That would be correct.
Okay. And from that time of 12:57 p.m. to the time of 2:26 p.m., had there been any notable change in Mr. Jackson's condition?
No.
Okay. Dr. Cooper, I noticed in the medical records the patient identifying labeling system assigned to decedent Michael Jackson actually has a particular name, and I'll read it: Trauma WM0241, Gershwin, Gershwin. What is that reference?
For circumstances such as a code or say a trauma patient, a patient that's coming in that is critical, in which we need to be able to access medications, get an immediate chest x-ray, and immediately obtain sort of lab data, we need a system of labeling, and there's not time to register the patient. So we have pre-made packets that include a doctor's note, a nurse's note, or a code note, extra labels, stickers that can be placed on blood specimens, x-ray requests that are already labeled, so we can immediately begin to order treatments and link everything to that one record, so we don't make a mistake.
So these are labels that are created prior to even the patient's arrival at the hospital?
There are a series of packets that run in alphabetical order, and the next packet up is...
Okay. And that's so that there's no delay in creating these labels and record-keeping system when the patient's there waited to be treated on?
Correct.
Okay. And so in the case of Michael Jackson, was the labeling system unique to Mr. Jackson?
The medical record ID number is unique to the patient.
Okay.
Because it's an alphabetical system, there will likely be another trauma Gershwin within a certain number of months, but each patient has their own unique identifying medical record number.
Okay, and that number is reflected in all of the medical records as well as your report in this case?
Correct.
Okay. May I approach the witness?
May.
I'm approaching with her handwritten notes. Is the label depicted, for example, on the first page of your handwritten notes?
Yes.
Okay, and does that have what I read previously, trauma WM0241, Gershwin, as well as the accompanying medical record number?
Yes, it does.
Okay.